I'm Dr. Randy Daniel in Stockbridge, Georgia, and I'd like to talk to you about what you, the patient, can do to prevent dental disease. Recognize that once you get dental disease, you either have to get it treated or eventually end up losing your teeth. There are two kinds of dental disease that we treat: tooth decay and periodontal disease, which involves the gum and bone tissues. Both types are caused by tobacco usage and bacterial plaque. Bacterial plaque is a sticky, invisible substance that adheres to the teeth. If you remove it daily, you'll prevent periodontal disease and have little, if any, tooth decay. Since bacterial plaque is invisible, we will show you how to detect it with a product we call disclosing solution that we give our patients. You will notice if you look at this patient's teeth, you'll see no plaque. In fact, they're pretty white teeth. After we paint his teeth with disclosing solution and rinse the teeth off, the red splotches remaining are the bacterial plaque. If that solution shows up on the video, let me know and I'll change the video. Notice that he's got these red splotches around his teeth. They tend to accumulate more along the gum line and in between his teeth. Now we're getting ready to show you how to remove this bacterial plaque. And you can see by his brushing technique that he's got a soft bristle brush at a 45-degree angle going back and forth slowly in gentle motions. And notice on his lowers, he's having to also use a 45-degree angle, but he's going in the opposite direction that he does on his lower teeth, upper teeth rather. Notice he's going down on the back side of his front teeth now. You can't just brush the front side. You can get tooth decay and gum disease on the back side of your teeth too. So he's going down on the back side of his lower teeth. He's getting ready to do the back side of his upper teeth. See, it's an inverse motion from what he had before. Notice that on his back teeth he's going at a 45-degree angle again, back and forth, real gently, because you've got to brush the back side of your teeth too, because you can get gum disease and tooth decay back there also. Notice on his upper teeth he's going back and forth on his upper back teeth, on the inside, cleaning them off. Remember, he can get tooth decay back there just as easily. Now notice he's doing the tops of his back teeth now. Now this is where 70% of the tooth decay occurs, is on the tops of teeth. So notice how he's doing the tops of his teeth now. He's getting ready to do the tops of his upper teeth. If you'll notice, he's gotten the bacterial plaque off of his front teeth pretty well. But open up, if you'll notice right in between his teeth, he's still got bacterial plaque. Now this is where the particularly damaging periodontal disease and tooth decay occurs, is in between your teeth. Alright, notice how the floss is going up and down, up and down, up and down. See how it's getting the red plaque off of there? Now we're going to reverse it. It'll wrap it around this upper tooth like that. Notice how he's still going up and down the surface of the tooth. He's got it wrapped around. He's getting ready to wrap around that other tooth. Notice how he's got it wrapped around his lateral incisor, going up and down. See how he's going up and down there, real gently. Now one thing I'm going to make a remark about, this is unwaxed dental floss by POH. People often ask, which is better, waxed or unwaxed? Really, neither makes a difference. Whichever you like the comfort of in your mouth. They both can get off bacterial plaque. You can find that out if you put disclosing solution on. Okay, if you've got enough space between your teeth, you can also clean them with an interproximal brush. They come in 3 sizes, and the one you see here is made by Butler and available at all retailers like Walmart. This particular one folds up, and it's handy to put it in your pocket. Notice how he's getting ready to take it out and insert it on the inside, pushes it in, ready to go in his pocket, and he can take it with him anywhere he wants. Notice he's gotten all the bacterial plaque off by properly brushing and properly flossing. If you look, you'll still see some residual red on a little bit of his gum tissue, but it's removed from all of his teeth. You can do this at home just as well as he can. You can notice that this patient has no decay on his occlusal surfaces. Those are the tops of the teeth. And we're getting ready to put sealants on there to prevent him from getting any tooth decay on the tops of those teeth. The first thing I will do is I will use a ProfiJet to make sure there's no bacterial plaque trapped inside those grooves, and we'll clean that off. That's really high. You notice what we're getting ready to do now is we're putting the etchant on top of the occlusal surfaces of these molar and premolar teeth that currently have no tooth decay, and this will prepare the enamel rods to let the bonding material and the sealant go into those enamel rods and prevent tooth decay from getting in. Now, one thing about sealants, it won't do anything about preventing decay in between teeth. It's just good for the tops of the teeth. For the tops of these molars are where we see about 70% of the tooth decay that we have. Okay, right now we're rinsing the etchant off that we just put on. As you can tell, the teeth have been etched now. But right now we're getting ready to put some sealant on there. So we just drop it on here. This flows on here. And we're getting ready to use the curing light on it. These new curing lights are much, much quicker than the older models that we had. So it won't take very long to do that. A little bit of a blast of air on there. Make sure it hadn't cooled up too much. I'll take care of that. Are you able to see back there now? Okay, ready? Say when.
Go ahead.
As you can tell right now, we're putting the curing light on there, and as I said earlier, these new curing lights don't take nearly as long to put sealants on. So most any child can tolerate this at a very early age. And it's very traumatic for some children to have a dental procedure done. And when you consider that you can do this and keep them from having, you know, the trauma of, say, an injection or having a lot of things in their mouth for 30 minutes to restore a tooth, it's certainly a very good investment. As you can tell, we've got sealants on all four of these teeth. And a remarkable thing about this is, one, it's very quick, and there's no trauma involved to the patient. Let's summarize what you, the patient, can do to prevent dental disease. First of all, stop using tobacco products of all kinds. Brush and floss correctly every day, just as we showed you in the video. Have sealants applied where applicable. Remember to get your dental checkups every 6 months. And if you'd like to learn more about dentistry, treatment, and prevention, I invite you to go to my website. It's drrandydaniel.com. That's drrandydaniel.com. And we hope you'll visit our website.